The acute coronavirus testing shortage in the U.S. means that right now, as you were just hearing, the message from everyone is we need to keep the hospitals clear for people with severe cases, and you can't get a test unless you're really sick, which, because we don't have enough tests, makes sense from a medical standpoint. But from an epidemiological standpoint, it means we just don't know the scope of the pandemic. We can't react or take proactive measures accordingly, particularly not regionally. Now, we didn't have to end up here. A series of failures and missteps by the federal government has led us to a point where we are now doing less testing than any other comparable nation. Joining me now is Dan Diamond of Politico, who's done some very in-depth reporting on the federal government's response. One of his recent pieces is titled "Trump's Mismanagement Helped Fuel Coronavirus Crisis." Dan, it's a great piece, and you've done great reporting about this. Take us back a few months ago. What were the early missteps in terms of how the White House and the president how proactive or not proactive they were in going at this?
Well, I think it depends how far back you want to go. But the starting point for me, Chris, would be in January. Secretary Alex Azar, the health secretary, did become alarmed about the spread of this virus in China. He tried to take that message to the president. But the aides around President Trump, some of them who don't like Azar, who have fought Azar, Azar's own standing had fallen somewhat in the administration. Some of them thought that this was not going to be a presidential priority, so tried to steer him away. By the time the secretary did brief the president, which was mid-January, it was around the same time that the first patients were being discovered in the United States, people who had returned from China. That could have been a moment for urgency, for the administration to really put all of the resources that we now see the Trump administration doing. But in that moment in January, and really for much of February too, the urgency just wasn't there, which public health officials have said privately, this is a shame. China bought the world time with its significant measures to lock down its population. China made lots of mistakes too, but by seeing the explosion of cases and knowing what was coming, the U.S. had time to get ahead, time that was not used to its best advantage.
You said this in an interview with Terry Gross on Fresh Air. You said the president attached to rosy scenarios about coronavirus, fixated on case count, and conveyed to staff that low numbers were better politics for 2020. What do you mean by that?
The president and his team knew early on that any panic or perceived panic around this virus could be devastating to his campaign. President Trump has been able to run ahead of many problems because of the success of the economy. This threat, as we've seen in recent days, this public health threat is also an economic threat. The president's team did not want to put out notes of panic, did not want to alarm the public, perhaps unnecessarily. So there was a lot of wishful thinking, a lot of hopeful talk, and some efforts to try and pierce that bubble just didn't get through. Now, it's interesting to talk to some of those officials today, Chris, because everyone swears they knew this was a problem. It was just someone else around the president who didn't want him to know. But the president himself focused so much on the numbers and the case count. I was writing a story and he came out and did a press conference at the CDC where I felt like he scooped my story. He said, I don't know if I want these patients to come off a cruise ship because I like the numbers where they are. That message in public is what he has also reiterated in private.
Meaning that there is a message from the top that we don't want high numbers. And high numbers are what you get if you're testing adequately and actually properly surveilling the disease. And so the president has been sending a public and private message saying, like, I don't want to know basically how many cases we have.
I think the message has changed this week, especially between the primetime Oval Office address, the comments in the Rose Garden today. But yes, Chris, the feeling from the top that this could have been a message of we need to find every single case in the country. We need to make sure every base is covered. The steps that have been taken recently could have been taken weeks ago. But the belief was that the border control strategy, which the president attached to it, lines up with some of his other thoughts on national security. That was seen as sufficient and working.
Right.
There wasn't much of an effort to go beyond.
And you hear him say that. He says, we close the border, which, by the way, is not really true. I mean, obviously we didn't, because there's cases from Wuhan that ended up in the U.S. that were probably transmitted. So there were some travel restrictions, but it was not airtight. But you get a sense when you listen to him when he's announcing the European travel restrictions that, like, that's all you need. Build a wall, shut it off. But of course, the virus got here anywhere.
Yeah, viruses don't respect walls all that much. I think that public health officials, and I've talked to enough, would say The China moves were understandable. This was a mysterious virus. It may have slowed things down. The Europe moves are a little less obvious. It's clearly spreading in the United States. And I think what's complicating, Chris, is we didn't let our European partners know. They were offended. They were upset. And there are major corporations that would help us fight and test the virus. We need to partner and get supplies from Europe in the weeks and months moving forward. So it's a moment where there are obvious things that need to be done, but some of those things are politically very difficult. And until recently, the president and his team were hesitant to lean into them.
All right, Dan Diamond, who's been doing great reporting on this, as always. Thank you for being with me tonight.